This will be the physical therapy video portion.
Jimmy, I'm one of the physical therapists that may be working with you while you're here having your joint replacement surgery. Physical therapy is essential to a good surgical outcome. Your physician knows how important therapy is and wants you to participate with every session. The therapy really does help. If you feel that you are unable to participate, your physician would like to be notified. It is very important to get moving after surgery, any surgery. It decreases the risk of blood clots, post-op pneumonia. It helps you prevent from getting weak and deconditioned. It also assists your body in overcoming the effects of anesthesia. And of course, it gets that new joint moving. Now, we usually show up the day after surgery, but in some instances, we do show up the same day of surgery. It depends on the type of surgery you have, the time of day your surgery is, and per your doctor's request. But when we start, we'll come by twice a day to work with you, once in the morning and once in the afternoon, 7 days a week. Even on weekends, you get to participate with therapy. With many of our joint replacement procedures, peripheral nerve catheters are used for pain control. They numb your leg so it doesn't hurt as much, but they can also make your leg muscles weak. During therapy sessions, we will review some basic exercises that help strengthen your muscles, improve circulation, and get your new joint moving. One of our main goals is to get your new joint moving so it doesn't stiffen up while it's healing. So remember, motion is lotion. We encourage exercises for circulation, but also to reteach the muscles to listen to what the brain's trying to tell it. These exercises may include ankle pumps, which involve moving your ankle as though you're pressing on the accelerator of a car. Isometric exercises such as quad sets, hamstring sets, and gluteal sets are also usually included in your therapy session. These exercises involve tightening a specific muscle group and holding it for a count of 3, and then relaxing them, and then repeating that. Now, as the numbness from your peripheral nerve catheter wears off, you may progress to strengthening exercises. Your physical therapist will help you as you need it. Included in these exercises may be shoulder quads or terminal knee extension, same name for the same exercise. Straight leg raises, hip bending and hip straightening, or heel slides, to name a few. The primary focus for the total knee rehab is for you to get as much bend in your knee as quickly as possible. The best time to move your knee is when it's numb from the peripheral nerve catheter before scar tissue sets in. The primary focus for the total hip rehabilitation is to make sure you can walk safely with your walker and protect your hip while it's healing. Depending on the type of total hip surgery performed, you may have movement restrictions. For example, if your incision is on the side of your leg, you may be advised to avoid excessive bending at the hip, crossing your operated leg, and rolling your leg inward. In other words, you can turn out and be a duck, but don't be a pigeon and turn in. If you have these restrictions, you will be taught the proper way to getting in and out of a bed and a chair. Therapy sessions for both hip and knee replacements will also include getting you out of the bed. To start, we like to sit you and dangle you to the side of the bed for a while to see how you feel. If all goes well, we continue with standing and teaching you how to use a walker. Remember, with many of our joint replacements, peripheral nerve catheters are used for pain control, and that means your leg muscles can be weak. So because of this weakness and as a safety measure, we may put you in a walking harness at first. Your physical therapist will assess the need for this safety harness during therapy as you regain more control of your leg muscles. Your safety is our priority. Please never try to get out of bed alone or even with a family member helping. The chances of falling and injuring your new joint aren't worth the risk, so call, don't fall. Your physical therapist will develop a therapy plan for you based on your specific surgery and condition, and will modify this plan as needed, since everyone progresses at their own pace. This post-surgical individualized plan trumps any of the exercises, movement restrictions, or other demonstrations presented in this video. Well, I hope this video was helpful in understanding what to expect from physical therapy. We look forward to seeing you and helping you move forward through your journey through improved functional mobility